Hey, good afternoon, everybody. This is becoming a daily briefing, and we have a new setup. Plenty of social distance. I just wanted to say, it's been a couple of weeks since our first infection. We have to announce we had another 35 infections, 194 total, 40 in the hospital. We are testing close to 1,000 people a day now. You maybe remember when we started out, it was 20 a day. So the number of infections reported is a reflection of the fact that more people are infected. It's also a big reflection of the fact that we're testing so many more people. And I do regret to inform you that we've had our fourth fatality now, again down in Fairfield County, where all the fatalities have been. And it's worth noting that we now have had a COVID infection in every one of our Connecticut counties, although predominantly in the southern part of the state. It's worth thinking about. I think about this in terms of supply and demand. As I think about the number of people infected, we have 40 people, COVID-related illnesses in our hospitals today, 40. We know that number is going to go up. We have to prepare for that. And that's the demand. And we're also thinking about the supply to make sure we have a healthcare system that's ready to respond as this demand continues to pick up. And when it comes to that supply, we've had a couple of priorities. We've been working in very close collaboration with our friends in the hospitals. And we've all emphasized, and I've emphasized this with our the president, the vice president, and Pence's task force in Washington. When it comes to protective equipment, protective gear, the masks, the ventilators, there's a nationwide shortage. We did get a small allocation from the feds. We're getting that distributed now to our hospitals and nursing homes, but we have a long way to go there. I want to tell, if there's any company out there that has access to PPE, protective equipment, masks, etc., let us know who you are. We'll buy it if we can. Go to 211.org. If you want to donate something, we'll pay top price. If there are any companies that have the ability to manufacture this, we'll place an order. We'll help you get the incentives to get started. And I've got fellow governors who will make that order even bigger. We're trying everything we can to make sure we get the necessary protective equipment and the masks and the ventilators necessary to take on what could be a surge when it comes to the COVID infections over a period of time. We're working on this every day. One of the first places we're going to find additional equipment and masks and even ventilators is from a lot of our smaller non-urgent care facilities. And those we're trying to free up right now. And if you have non-urgent, if you have elective surgery, all of our hospitals are stepping back and not doing that. And that's really important. That's freeing up beds. That's freeing up ICU capacity in some cases. That may be freeing up ventilators and other gowns and protective equipment. And I urge each and every one of you, even in those offices where you may not expect to find equipment, pay special attention. I was interested listening to Andrew Cuomo's telecast where he said they found 100,000 masks were donated by Goldman Sachs, the financial institution. So you'll be surprised where we may find masks and other protective gear. I'm told the utilities maybe should be taking a look, and our construction and our utility trades are places we should be. Another piece of the supply that's very important is people. We need people. We need trained nurses. We need each and every one of you. And I got to say, I've been so proud of the number of people. I think it's close to 500 nurses have stood up, thought they were retiring on the sidelines, ready to come back and ready to help us when it comes to taking on the folks we need. They're in the Medical Reserve Corps. I guess that's what they call it. We're also talking to the nursing schools, finding ways to get them more involved earlier. Josh is working on changing the certifications, so if they're nurses in nearby communities, maybe across the border, New York or Massachusetts, and a Connecticut hospital is closer, they can come and make sure that we have the people power we need to take on COVID-19. I want to say, on a personal note, I've been so proud of the generosity of the people of Connecticut stepping up in so many different ways. They go to 211.org and find ways that they can contribute everything from gear to time to resources. One of our philanthropists knows that we had a real need in terms of daycare. More and more of our daycare centers are closing down. I urge those that are there to stay open just so we have that capacity, in particular for our first responders. Again, the doctors, the nurses, the police, the firemen, all those we need. And with school out, more and more of them need extra child care and support. So I'm very pleased to announce that a very generous donor has donated the millions of dollars necessary to open up 26 new daycare centers, 26 daycare facilities that will be nearby or adjacent to our different hospitals. And those hospitals then will be able to prioritize for doctors and nurses who have kids, make sure that they're able to get to work as well. So I very much thank you for that. I understand that each of those daycare facilities will start out with capacity for 30 kids. And again, we're following the CDC guidelines, no more than 10 children in any particular location or classroom. That's the supply side of the equation, what we're doing to increase capacity when it comes to facilities, when it comes to equipment, and when it comes to people that we need to do the work. But we know that if we don't reduce the demand for the health care, and if we can't reduce or at least flatten the curve when it comes to the COVID infections, we're going to be in trouble. And that's why Connecticut got going early. We were very early off the draw in terms of limiting big gatherings. When it came to the parades, I got to salute our mayors and first selectmen who helped take the lead and said no major gatherings. We followed on that with schools. We were early there in terms of the schools. I think that made a big difference in terms of what you see. Sports contests. Remember the high school sports and some of their playoff. That got a little bit of back and forth, but I think in hindsight, most people appreciate that was the right thing to do. Anything we can do to slow the rate of infection of COVID-19. So I'm here to announce yet another step up in our efforts to enforce social distancing. And we call our policy, stay safe, stay at home. I think you've seen, we're working in conjunction again with my regional governors. I think this is a virus that knows no borders. Andrew Cuomo is stepping up in New York with his in sending people, requiring people to stay at home. I think you see what's going on in California, and I think you're going to see other states following along as well. Stay safe, stay at home. What do I mean by that? Again, if you're over 70 years old, stay at home. Solitary exercise, no big groups, stay off of public transportation. But more importantly, when it comes to our local businesses, those local retail outlets, that office, telecommute, don't come into the office. Retail, don't open your retail store unless you're involved in some essential service like food, grocery stores, or healthcare, as in pharmacies, fuel, as in gas stations. I want to see all the rest of those non-essential services closed for at least a few weeks or for the foreseeable future. And David Lamont of Economic Development and myself, we were on the phone with a couple thousand of our small businesses, giving them just a bit of a preview of what we were thinking about and making sure they knew that we're going to be standing there alongside of them. We're putting in place and talking to the legislature right now about a significant, very low-cost bridge loan to help them carry through. I'm looking with great interest at some of the bills coming out of Washington, D.C., the Rubio plan that would provide significant bridge financing for our small businesses, if they don't lay off people for the next 4 months. And that's the proposal right now is that loan will be totally forgiven after 4 months if you honor your commitment. I've had a chance not just to talk to small businesses about what we're doing when it comes to stay safe, stay at home. I've also talked to our some of our major employers as well. There are a number of exemptions, of course, to this, and one of them is going to be major construction projects that are already underway, and another is going to be our major manufacturing facilities, especially those in the defense industry. The federal government has given an exemption for those in the defense critical infrastructure. So I talked to Pratt & Whitney, I've talked to Sikorsky, I've talked to Electric Boat, and I said, we understand you're going to be able to keep your facilities open and operating Anybody that doesn't have to be at the factory floor, send them home. Anybody who is on the factory floor, make sure they test themselves before going to the factory. Make sure they test themselves at the end of the day at EB or Pratt or Sikorsky. Make sure they're extra careful when it comes to social distancing. You know, no big gatherings at night, because that's important for their health, their neighbors' health, and when they get back to the Pratt & Whitney factory floor, it's important for the employees' safety of all their neighbors there as well. Look, this is, it's tough medicine. I think it's the right medicine. And what we're trying to do is everything we can to improve the supply when it comes to what we can do for our healthcare system, helping it to grow over time so we can meet the demand, and everything we can do to reduce the demand. So the name of our policy is stay safe, stay home. And we're going to get through this by working together and making sure each and every one of you takes so seriously what we're trying to emphasize. Nobody is indefensible when it comes to this virus, and that comes to young people and old people alike. Stay safe, stay at home. Thank you very much.
Governor, I have a question. You talked yesterday, and again you just mentioned it today, about continuing construction projects. Some states are actually pushing pause on that, and the construction companies are being urged to donate their masks and protective equipment to hospitals and clinics that are doing this testing. What are your thoughts on that?
We're certainly urging the construction companies, utilities, and others that may have extra masks to donate them. I think right now our policy is those major outdoor construction projects, transportation projects that are Charter Oak, for example, that are already underway, schools that are underway. They anticipate having that school done in time for a new school year. I don't want to interrupt that in mid-stride.
Governor, how will this be enforced? The stay safe, stay at home?
Yeah, are the police going to be doing anything, or is it more of a what?
Well, right now, we're looking at each and every one of you, and you've done such an amazing job of self-enforcing this. Obviously, Jim Ravello is here somewhere. Public Safety has met with or talked to our municipal police, and the municipal police are not going to be heavy-handed. But if there are 15 kids hanging out under the basketball hoop, they're going to say, guys, this is not safe for you, and it's not safe for the community. If there's a local retail store that stays open, it'll be a friendly reminder that the governor has an executive order you should be closed, and people could be subject to fines if they stay open.
So does this also include the judicial branch as far as closures are concerned?
Well, the judicial branch is, under separate order. As you know, they've closed virtually all their courthouses, except for some for really emergency cases.
How exactly will the exceptions work? In other words, every small manufacturer thinks they're essential. Every newspaper thinks they're essential. Every business almost thinks they're essential.
Who's essential?
How will the exemptions work, and how will that be enforced also?
Sure. So the process is going to be laid out via executive order that the governor is going to be signing, I think, as soon as we get back from this event. And it's going to set forth a set of critical industries which are exempted. A lot of the obvious stuff, healthcare, financial services and banking, the food supply chain, transportation, public transportation, child care services, all of the direct and indirect services that are critical to helping battle COVID-19 and keeping our economy moving as much as possible. By the end of the weekend, so by the end of the day Sunday, Commissioner Lamont in the executive order is going to be designated as the person who will be issuing the specific guidance around industries that are exempted, and those directives will be in effect as of 8 o'clock on Monday.
And you're just worried about gatherings. In other words, if everybody in a law firm is working from home, you don't care?
That is the best possible scenario right now, is people continuing to work and working from home. That's option one. Where that's not possible, and that's not possible in all those industries I just described, it's not possible in a number of our state agencies where we provide critical services, those people will stay at work. What this Stay Safe, Stay at Home initiative is about is the non-essential businesses and services that can't be moved home or haven't been moved home yet, that need to either be moved home or discontinued for now.
So will there be a fine, like, what is the dollar amount of the fine, and how does somebody prove that, hey, I'm going to Pratt & Whitney, I'm an essential worker, how do they prove if they get pulled over by a police officer that they are allowed to be out?
Look, you're on your way to Pratt & Whitney. You're not going to get pulled over by a police officer unless you're going 75 miles an hour. When I talked about no fines for individuals, we're going to work on this on a community-by-community basis. What I did mention was if there's some retail stores that are considered non-essential, if they stay open, they might be subject to a civil fine. Yes.
Are package stores essential?
We're package stores.
That'll be included in the guidance. I think they will be stay open at this time.
And this will be subject to change or no? In other words, this will be subject to an amended executive order if Industry X comes in and says.
I think everything we're doing right now in this world today is subject to change, Chris. Yeah.
Go ahead.
I was going to ask about restaurants. I know that they're still doing takeout service. So would they still be able to remain open and do takeout service?
Yes.
Yes, that wouldn't change.
So the local coffee shop can do takeout business only still?
Takeout business only, exactly right.
What about things like auto repair and hardware stores that are not essential unless they are because your seat doesn't work?
Yeah, we expect, so the question was auto repair, hardware stores, we expect those to stay open. Those provide services that could be essential for a healthcare worker to get to work, for example, if their car needs repair, or if there's repairs that need to be done at a hospital and we need tradespeople or supplies for those tradespeople to perform those repairs. So those are the types of things that will stay open.
What about parties? The governor of New York this morning talked about parties in houses, no gatherings of any size. You can't have your friends over. Are you talking about inside the house? What's your view of that?
I am. I hate to say it, but look, having a big party is a really dumb thing to do.
No, I don't mean a big party. I mean like 4 people over at your house, like just a gathering. What's your view?
The smaller the group, the safer it is for everybody. Let's just face facts. And the bigger the group, the more dangerous it is. Look, we have some legal limits we've set by executive order. Those are bigger numbers. I'd urge everybody, especially given your age, the smaller the group, the better. Not your age.
On the July 15th tax situation, is the state going to follow the feds? And particularly I ask because that would throw the money into the next fiscal year. Is that a problem, and is the state just going to piggyback on the feds?
What's July 15th, you know?
Yeah, we just saw that come down. We're talking about that with Secretary McCaw and the team, and we'll have additional guidance on that soon.
So this is no longer just a suggestion after you signed this executive order, you're ordering these non-essential businesses.
Yeah, we were telling you those retail stores that are non-essential do not open. Anybody stay at home. I'm talking to all the CEOs, reinforcing this in no uncertain terms. It's the most important thing we can do to reduce the demand. Our hospitals are going to be at peak demand sometime very soon, and I got to do everything I can to make sure we have beds available.
How are you doing on that beds available? Identifying facilities? I know you've been working on that pretty hard. I know Hartford was narrowing in on something you're doing very well.
And equipment.
Yeah, and equipment.
Well, I talked about the equipment a little bit. Yeah, when it comes to facilities, we're looking at locations nearby existing hospitals where we may be able to retrofit them. That could be everything from a dormitory room to a nursing home that's unoccupied. We've had a couple of folks come and reach out to us in that front. We thought a little bit about some of the field hospitals. You've probably seen some of those being built in Seattle and other places right now. Thinking of ways, probably the easiest and most effective thing we could do right now is all those things that we're doing elective surgery. Move those over towards primary care, or at least ICU, intermediate care.
Is that part of the executive order? Are you mandating that? Or, I mean, I feel like the hospitals have voluntarily
I think they've all done it.
done that.
I think they've all done it, yeah.
With all these tests, do you have any concern? Some people are tested, they're swabbed, et cetera, and they don't get a test result for 4 days, 5 days, 6 days. Are you concerned about that at all? Some of these private labs are sending the results out of state, literally, and it comes back, takes multiple days. Is that a problem, or is that on your radar?
Well, I'll start, then I want Josh to do this, but I think there's pretty good news. And we've gone from 20 to close to 1,000 tests a day. More and more of those tests are being done right here in the state of Connecticut. We just did something with Jackson Labs, you saw, with Hartford Health and UConn Health just the other day. We're going to have more testing and more accurate and faster responses every day for the next 3 months.
In your opinion, Mr. Governor, is this the way it's supposed to work in America? States are scrambling to put hospital beds together. Hospitals are making up masks and asking people to help them make up masks. This is kind of third world stuff from a federal standpoint.
I think the federal government's been very slow off the draw on this. If you saw what happened in World War II and other big events, it was the feds that took the lead. It was the feds that organized the manufacturing to build what you needed there. And obviously, it'd be a lot more effective if the feds had stepped in 2, 3, 4 months ago, ordered the masks, ordered the gowns, ordered the ventilators. We'd be in a much better position. So you're right. The governors are taking the lead, and they are scrambling to catch up. I'd say the feds are more helpful today than they were 2 months ago, but that wasn't tough to beat.
What are the additional restrictions on state employees further from this point on coming in and working?
Yeah, so the question is, how does this apply to state employees? So we will be, our commissioners are currently looking again at same exercise, non-essential functions. We've already, as I think people have seen over executive order over the last week, closed a lot of our customer-facing facilities. We've provided extended deadlines so that we could send more people home. We've dramatically increased the number of our state employees who are telecommuting. But we will be going through a process over the weekend where we will be looking at additional functions which are not able to work from home at this point, but which we will discontinue, consistent with this executive order around non-essential services, which is a good moment to also mention that whether it's our state employees who may be home, who don't have state work that they can do, or there's going to be a lot of other people from private non-essential businesses who are going to be home that don't have work to do. Your number one priority is to keep yourself and your family safe and try to maintain all that social distancing. But there are ways that you can still be helpful to fighting COVID-19, and I'll give you a couple examples. We mentioned, I think 2 days ago, the governor mentioned that we have a blood shortage in this country right now. A lot of companies have canceled their blood drives, and so if you can go give blood, please go on the Red Cross website and go donate. You can volunteer at your food pantry. Some of the pantries are experiencing a shortage in volunteers. Some of the volunteers they've historically counted on are concerned, or maybe they're elderly and they're not showing up. So call your food pantry and see if you can volunteer at a homeless shelter. Or the small things. If you have a neighbor who has children and works in the healthcare industry or is a first responder, reach out and see if you can help them with childcare. There's even if your job means that you on Monday you're going to be at home with nothing to do, there's still critical roles that you can play somewhere in the supply chain of helping fight COVID-19, and we'd really encourage everybody who finds themselves in that position to find a way to serve.
You might have a different name for it, but would you say the executive order is the same as Governor Cuomo's as far as the businesses go and the shutdown, for lack of a better term?
Look, it's the same intent. Keep everybody at home, with the exceptions of major manufacturing and major construction activities. Everything I can do and work on a regional basis, I think makes sense. It makes clear direction for all of our businesses, as it did for our students, as it did for our bars and restaurants. That's our intent. Thank you, everybody.